I had an opportunity to present to the board about what it's like to be a mental health professional who's got a mental health problem. I had a diagnosis of psychotic depression just after qualifying, and I experienced some really good practice, but also some really bad practice. As part of moving forward, the board was interested in how to support mental health staff who have mental health problems. With mental health patients, a blanket approach never works, and with mental health nurses, it's exactly the same. I'm very humble to be working for an organisation that not only heard my story, but really listened to it, and without any defensiveness, decided that we needed to change the way in which we deal with our own staff who have mental health problems.
And a little while ago, Melanie Walker asked us if we would specifically think about what we could do in an employment specialism to help staff who actually work for the Trust. I think it's often been recognised that although our Trust provides services for people with mental health conditions, often we're not very good at looking after our own staff who are also experiencing anxiety, depression or other difficulties. So what we're looking to do is to offer that support to staff, and by doing that is helping the Trust become more perhaps an employer of choice or work towards excellence in that particular field, and show that actually, as well as providing good services for members of the public, we also look after the mental well-being of our own staff as well.
As part of being a clinical team leader, one of my main, I suppose, strengths and desires of wanting to improve the workforce and improve the Trust, I suppose, is supporting students. I've got really close links with Plymouth University, so I'm a mentor to students. I often do a lot of interviews down there, and also with the Fivers as well. It's just really important for us to respect and support staff in their development. It's about looking at what matters to them and developing a workforce that feels cared for, valued for, and just feels part of something.
I've also been really privileged as well over the last 12 months. I took a venipuncture course, so now I help the doctors out as well. So when people come into hospital, I can take their bloods. I'm very fortunate that I can also perform ECGs. Just attended a tissue viability course as well, so which I enjoy very much.
I was a student within Devon Partnership Trust for 3 years during my nurse training. During this time I spent time with different directorates. Every time the staff was very welcoming, always very helpful with any issues that I had, and generally we were all very happy. It was a happy environment to be in. This is one of the main reasons that I decided to come and work for Devon Partnership Trust, and I'm very looking forward to starting my career.
I come from out of area. I managed to arrange a week of placement with Langdon Hospital. That week was amazing. Staff were really supportive and it was such a good atmosphere, and now I've got a position as a staff nurse there and I'm really looking forward to starting.
The aim of the Together programme is to do exactly what it says. It's to bring people together. Our main focus are people who use our services, their carers, families, partners, and our staff are really important in ensuring that we have a programme that can actually look very closely at everything we do.
And I think that co-designing, co-production really works well. There is that different aspect that people with lived experience can bring that can make it a complete and a more holistic view to if it's services redesign or what's going to work in say with the peer support.
There are lots of different ways that people can get involved. So what we've seen through the Together programme is we've been able to bring people who use our services, their carers, their partners, their families and our staff, and we have some excellent examples already. So we have what we call patient councils. We have examples of that within Secure Services, and we have the Cedars Academy is another example where we have brought that unity of those people in a programme that has been able to let people feel more empowered in what they do. And actually our staff are really beginning to feel really encouraged and confident in the way in which they're approaching that within their everyday practice.
At the Patient Council, we talk about things that are important to us and can't be resolved at ward level. Some of the changes we have made are my dog can now visit and my involvement in staff training. I did a staff induction training for the first time yesterday and it felt really rewarding.
Last year I won the Kesler Trust National Award for Animation and Music, which I produced with staff at Langdon. I have entered again this year. Just recently they sent me a letter asking if I would like to be mentored by the Trust. If this goes well, I will qualify for a scholarship provided by Kesler. I would never have achieved this without the support and staff of Langdon.
I am currently the Patients Chair for the Patient Council meeting. It helps patients and staff produce great things. I feel sometimes that I'm on a journey with the staff as I do the induction and also do staff interviews. It's nice to see staff come through a journey.
My role alongside the clinical director is to make sure we offer safe, effective services. And one of the many ways we do that within Secure Services, and we work with co-production, is through our patient forums and therefore our patient council. We have an ambition by 2018 that we will have patients, staff members and carers actively involved in at least 75% of the way that we run our services.
We have been using the 4 Steps programme since November of last year, and within that time we have seen a significant reduction in violent incidences and an increase in incident-free days. This has been particularly surrounding the use of engagement rather than observation, and we hope to utilise that standard going forward. I know that this is one of the big drivers within DPT. I know across the Trust 13 to 19 of our wards have seen a reduction in physical violence, and going forward I know that DPT aims to use this initiative and many others as we strive towards a centre of excellence.
The 4 Steps to Safety programme is one of the many ways that DPT are looking to improve and develop on our journey to excellence. Others include continued smart working, new service developments and new approaches to recruitment.